Good morning. This is the Lew Rockwell Show, and how great to have as our guest this morning Dr. G. Keith Smith. Keith is a physician in Oklahoma City, Oklahoma. He's the founder of the quite extraordinary Surgery Center of Oklahoma that involves more than 40 surgeons and uncounted numbers of support personnel in providing private medical care of the sort that used to be available in this country for some time. Of course, beginning, really, we go back to the Hill-Burton Act in the 50s, but certainly with Medicare and Medicaid and the HMO Acts and, of course, now Obamacare and many, many other increasing interventions in medical care by Republicans, Nixon and Reagan, as well as by all the Democrats. I was at a doctor's office not too long ago here in Alabama, and it's like a DMV office. I mean, there's a big, thick piece of plate glass in front of the receptionist. It's just so unpleasant. I mean, I always think there's something wrong with a business where there's something called the waiting room, too. I mean, that sort of sets off the wrong expectations right to begin with. So we don't have what ought to be, from an economic standpoint, the correct model of medical care where the patient is the employer of the physician, and the physician and the surgeon are responsible only to the patient, not to Medicare, not to any other aspect of the government, not to insurance companies, which are, of course, quasi-government, the Blues and so forth. You've set up and are successful at having set up something that's out of the past but also out of the future. So tell us how you got started with the Surgery Center, and tell us something about the great success you've had.
Well, Dr. Stephen Lantier and I are both anesthesiologists, and we co-founded this center. And an opportunity presented itself in a horribly mismanaged facility in downtown Oklahoma City. We were able to actually buy on a hunting trip, which is another story. But we made that move because we were not treated well by big hospital administrators. The surgeons that we had formed relationships with and that were really good surgeons were not treated well by the hospitals. And, patients weren't treated very well. We thought, we can complain about this for the rest of our careers, or we can do something about it. So we bought this facility and got started. We were different in that we were both very libertarian-minded, both very influenced by your writings and the writings of the people at the Mises Institute you're affiliated with. So we decided we would take no government money to start with. We had come to the place where we saw accepting Medicare money as an act of theft on our part. So that's the first thing we did. And then the second thing we did that was different was we adopted a policy of price honesty. We knew that from patients we'd taken care of, that many of them had received bills that were just fictitious. That when they received these bills, everybody knew there was no chance that the hospital was going to be paid the amount of this bill. And we thought that was kind of silly. We would practice price honesty. So over a very short period of time, the word got around amongst the uninsured people here in Oklahoma City. And if they needed their hernia fixed, or they needed their gallbladder taken out, or their child's tonsils taken out, they would contact our surgery center. And I was quoting prices and horse trading, more and more every day. This basically led to a state where we had quoted so many prices that we had a pretty good feeling for what the market was for what people who were paying out of their pocket were willing to pay, and that was really useful. And also the word spread around, that we were reasonably priced. We outgrew that facility. It was just a wild success. And keep in mind, we opened this facility under the most unimaginable odds. We had all of the usual cronies you could imagine in big business and hospitals and insurance companies, lined up against us and just openly joking about our impending doom. And it turned out to be just a wild success, so much so that we outgrew it and moved into a facility that we built that was just customized basically for us. And it's 40,000 square feet, and it's a major surgery center now. We do a lot of surgery here. We continued with our policy of not accepting government money. We continued, our pricing honesty And things, it just didn't make sense to me. It just didn't seem like the market was at work, because we felt like the care here was second to none. Certainly as good or better than anything here in Oklahoma City, but we wanted to be busier. We knew we were at least as good or better, and we knew that our prices were very competitive. In fact, we knew our prices were probably the lowest anywhere in the United States. So we didn't understand how that value wasn't translating into more business. So we took a radical move in 2009, opened up a website, and actually displayed the prices for almost every procedure that we do here. The only reason we don't have, I think, everything on there is just for space concerns, just not to make the website too long and boring. And that move has created a stir. It's sent shockwaves here in Oklahoma City locally, but it's even gathered the attention of people outside of the state, even outside of this country. One of the first things that happened was that the Canadians started showing up at our facility, and they saw the price for a carpal tunnel surgery on our website, which is $2,750, I think, and they realized they could buy a carpal tunnel surgery and not have to stand in line for 2 or 3 years or whatever that is in Canada. And that was a very interesting thing to see, that for that system that's so wonderful to the north. This all you need to know is that Canadians are coming to Oklahoma City to know that that is a failure. The next thing that happened is there were some big self-funded insurance plans that were affiliated with large businesses in this area, and they realized they were getting fleeced, because they were able to actually look at our prices and compare them side by side with what they were paying at these huge corporate cartel hospitals. And over the years, Dr. Lonte and I were able to see the big, giant, so-called not-for-profit hospitals as the government entities that they were, because the vast majority of their money comes from taxpayers. So there's this very distorted marketplace in medicine, and we're really an eyesore for everybody in this area, because we've, by virtue of our having adopted price transparency, have outed these scams and schemes and these robbers, basically, and how they've just really fleeced the sick. It's been a lot of fun.
I know that you're not only getting business from Canada, you're getting business from other countries. You know, of course, well, that there's a form of medical tourism that goes on, where a lot of Americans will go to Thailand or to India or to Taiwan or other countries. They can actually pay for their travel and get the surgery done in a foreign country, and it's much less than dealing with an American hospital. But of course, you're able to undercut those prices. But what I want to ask you is, how do the other docs relate to you? We know the hospitals don't like you, the Blues don't like you, but how about the other doctors?
Well, the physicians that I'm partners with here love me.
Oh, yeah, well, of course. But I mean, your competitors, and of course, it's an anti-competitive measure, but wasn't it at least an original part of the medical alleged code of ethics that you didn't post your prices, that you weren't transparent about pricing?
I think the code of ethics was that we would not advertise. And again, as physicians, we're not advertising. We're advertising the prices of our facility that we own and control. So that's gray, but my competitors, I think, are very disturbed by this, because basically physicians don't like to compete. And I think a lot of people go into medicine and hide behind their licensure, and they don't want to compete. But I also have competitors that are thrilled by this, because they know that what we're doing, if this catches on, it breaks the back of the cartel. And for physicians and for patients, that is a great thing.
Are you still going to be legal under Obamacare?
Yeah, Obamacare doesn't really apply to us at this point, because we don't take any federal money. And more, we are dealing with self-funded plans, and those are completely off the Obamacare radar, at least for now. And the medical tourism thing you brought up is interesting too, because I actually tried to beat those prices that people were advertising out of the country, thinking, if you're in Alabama, you'd rather come to Oklahoma City than go to Thailand. At least you save the travel costs. And I think I was reading, I think it's Bill Rounds, who wrote a piece on your site this last weekend about, why you should go to private hospitals out of the country so your medical records aren't available, to the feds. And by not taking federal money, our facility actually does not have to comply with the requirement to adopt electronic health records. So we have paper records here, and the patient's confidentiality is totally secure. And Rounds is right when he says once the data is digitalized, it's not secure. The leaders for patient confidentiality in fighting electronic health records, it's Jane Orient's organization, the Association of American Physician Surgeons, and we've taken a lot of our stances here just out of their playbook, and they deserve a whole lot more credit than anybody's given them.
No, AAPS is a great organization, and one of the things that astounds me about it is that it was founded in the 1940s to fight all the sorts of things that have actually happened, and they've never sold out.
Never.
I mean, that's pretty unusual, unfortunately unusual.
Several years ago, I had the honor of speaking at an AAPS meeting just after Dr. Paul, and what an impossible act to follow. And I remember thanking him for making sure that I followed him, and he of course, he was very cordial and he laughed. But that is a great organization, and one that I know Ron Paul is very proud to be associated with.
Yeah, he's a life member.
Yes.
He's a strong supporter. Just as a practical measure, also, when people come to the way, of course, you can maintain the prices that you maintain, they have to pay before the service. There's no extended pay. There's no, of course, not dealing with the blues or any of this. It's the actual fee for service before the service, and as a result, not only do you get this great care, but you get the great price.
That's right. And to be honest, we actually deal with some of the insurance companies. We will, as a courtesy, file insurance for patients that have it. But for the people who don't have insurance, for the people that are part of self-funded plans, for the people who want to just pay for it, then the fees that are on the website apply. Interestingly, we've had people come in and have their surgery, and they paid us up front, and then they turned around and filed with their insurance company, and the insurance company paid them off their usual charge master rate, and the patient made out like a bandit.
My dad was a surgeon and opposed to Medicare and Medicaid, wouldn't join the AMA, and had your sorts of views. So I've been watching all this for a very long time, and then I got to be editor of Francis Davis's magazine, Private Practice, in Oklahoma City for some years. It seems like everything we wrote about in that magazine, a warning about, of course, it has all come true. And ever since this stuff all started, we've seen the hospitals profit immensely. These things are just growing like cancers, the new wings and new everything for the bureaucracy doing very well. The pharmaceutical companies do very well. Insurance companies do very well. A lot of the doctors do well, and other medical professionals, not all of them. But definitely the patient is crushed. I mean, it's a similar thing to all the subsidization of higher education. Everybody in the institutions does great. The student, whereas in the past, as Peter Schiff points out, you used to be able to work your way through school, as Ron Paul did, for example, worked his way through college. It sounds like science fiction today because, of course, the prices have been raised to insane levels. Same with medical care. It's possible at your facility, but it used to be possible across the board for middle-class people to afford medical care. They didn't have to face bankruptcy over this. But what the government has done is, of course, to raise the prices to humongous levels, to empower itself. Of course, as you talk about with medical records being part of everybody's federal dossier now, and the increasing control over everybody's medical care by the bureaucrats in Washington. So it's a horror that's taking place. Is anybody else copying you? You're doing this in Oklahoma City. Is this happening elsewhere in the country?
There are people that have taken notice of us that are working very hard to copy this, and there's some people here in Oklahoma City that are going to copy it. Actually, physician-owned hospitals here in town are going to step up to the plate and I think do some of this. Some of the patients were referred to our surgery center because we're an outpatient surgery center we can't operate on because they need open heart surgery or they need a total hip replacement or something like that. And I've over the years have made real good friends of guys that run hospitals here in Oklahoma City, and they have stepped up to the plate with upfront, transparent, packaged pricing. And so this has been going on here in Oklahoma City for some time. I think that they probably will come out of the closet very soon. And I want to point out, too, the prices on our website are inclusive. They include the facility charges, the anesthesia charges, and the surgeon's fees. So when people look at our fees, that's certainly something to keep in mind.
And we're certainly going to link to your website and to that price list so that people can see just what's possible in a free market. But, you mentioned your libertarian orientation, which I would say is evident from everything you're doing. What got you started? What got you interested in these kinds of ideas?
Well, I think it was when I discovered that I was in a bubble, and I didn't know until it burst. I'd planned to come to Oklahoma City and do primarily cardiac anesthesia, and most of the people that need cardiac anesthesia are elderly, and most of them are covered by Medicare. And Medicare just basically decided to stop paying anesthesiologists. And there was this huge, it was almost like a subsidy to create cardiac surgeons and cardiologists and cardiac anesthesiologists, and then the bubble burst, and I began to wonder, what's happened. In the meantime, I was introduced to some writings by Bastiat that got me thinking, and my dad actually heard you on the David Gold show in Dallas and said, we need to check out this von Mises Institute. And one thing led to another, and I've devoured everything I can get my hands on. I'm no economist. I'm a doctor, but I consider myself a student of many of the ideas. I was telling my partner, Steve Lantier, here at the Surgery Center this morning that one of the great gifts that the ideas of the Austrian school has given us is our ability to predict, because the market always triumphs. It doesn't matter what the villains try. It's always short-lived, and the market just always seems to triumph. So the true free market tradition gives those who understand it, I think, an ability to predict what's going to happen. And as entrepreneurs, that gives us a real advantage. It also has brought us a kind of a peace that we feel like our foundations in our economics and our philosophy are completely sound, based on the principle of private property. And, physicians, many of them, claim to be, fans of small government until you talk about cutting their Medicare payments, or they're fans of, small government until a competitor comes to town. And we've never subscribed to that here at our surgery center. It is a very Misesian property rights sort of outfit. That's our approach. I think the human action, and particularly Mises' writings about time preference, had a huge influence on me, and Hans Hoppe too. That is a staple of our partnership agreement here with our surgeons. That was very very powerful for me. Dr. Higgs' Crisis in Leviathan is one of my favorites. I subscribed to your and Murray Rothbard's newsletter long before LewRockwell.com came along. So, I've been an apostle of the Austrian school for a long time.
Not too long ago, I was talking to a medical student, Bowman Gray. First of all, he was the only person interested in the entire student body or among the faculty in free markets whatsoever. He was the only interest. But I was astounded, of course you would not be, to find out how much of the so-called medical education consisted of how to code. How to get the most out of Medicare, how to get the most out of Medicaid, how to get the most out of the Blues, and to orient yourself entirely towards reimbursement from these third-party payers. And of course, when you have that kind of a system, the patient is just sort of a bump in the road to be gotten over. The focus is actually not on the patient. So you're a very bright light in what's unfortunately the government medical darkness these days in what you've done, and I congratulate you. It's just extraordinary. I hope many people emulate you, and it shows that for doctors who are interested in freedom as well as a satisfying practice, that it is possible to not become a robot for the regime. It is possible to be independent, to do good work, to benefit people, to be financially successful, and it's just a triumph. Keith, thanks for all you're doing, and thanks for coming on the show this morning.
Well, thank you. I'm glad to be on the show. We've never been more excited about the practice of medicine than we are now, and it's our really embracing the free market principles that you and the people that you're affiliated with have helped us to understand. Thanks a lot.
Thank you. Bye-bye.
Bye-bye.
Well, thanks so much for listening to the Lew Rockwell Show today. Take a look at all the podcasts. There have been hundreds of them. There's a link on the upper right-hand corner of the LRC front page. Thank you.